we'll get the recording. So welcome to the first webinar in this module. I hope you enjoyed yesterday and found it useful. It's going to be a very sort of small group of you. At most it's going to be 4, I think. So there's yourself, Bonnie Tromans from Derriford, Rachel Stanier, who's a member of staff. I forget which school you're in, Rachel. Are you in health professions? Zoe, what's her name? Zoe, I forget. I'm just going to go back to the chat room. Zoe, I can't remember where Zoe's from. And then there's probably Josephine, who would be the 4th member of the module. There may be some other people. Rachel, you're logged into the chat room, I see. Great. Bonnie, I don't know if you want to see and get into that. Bonnie, you have to open up another web browser. So onto your Internet Explorer or Chrome, whatever, open up another window, and in that window type this address there, http://hes.plymouth.ac.uk/chat/, and that will take you to something that looks like this. And you'll see there that Rachel and I are both in there. You're in midwifery. Yeah, sorry about that, Rachel. I couldn't remember where you were. Bonnie, we're waiting for you. To see if you can get into that. So if you can't get into it, just you could email. I'm just looking at, as I say, what you're seeing is everything that I see on my desktop. So when I have a quick look at my email, just to see if someone's there sending me an email, if necessary, you can mobile phone me if you're having any problems. But I think I will sort of carry on with the rest of this this content. So what you've got on your right hand side is you've got well, first of all, I'm hoping that you get in that chat room. Rachel's there, but and you should get this chat room so that you see a list of names on the right hand side, and you should be able to type in your comments at the bottom. Maybe you can have a go at this after the web chat, after the webinar, Bonnie, if you're not able to get there at the moment. There is a question and answer thing on the GoToWebinar screen, but I prefer not to use that because I prefer to keep everything into the chat room, because that's where others are paying more attention. So you can talk to each other even if you're not listening to me. So I'm going to just go into that chat room again, just one last look at it, and okay, Rachel, you want to try your microphone? So I'm going to give you one more chance, Rachel. Okay, so you're unmuted. You want to try talking? No, I'm not hearing anything, so it doesn't look like your microphone's working. So we'll stick with the typed chat. Bonnie's microphone works okay, but she's got a very noisy background. She's in the middle of the A&E department by the sounds of it. So we'll just carry on using typed chat, using that webinar. Okay, that's Rachel. But just one more look to see if Bonnie's there. No, never mind. I'll carry on talking and just go through some of the content, and we'll see how we get on with the with communicating with the two of you. So I was going to stop at this point and get you to talk to each other in the chat room, but as there's only Rachel in there, it's a bit difficult. I am recording this already, and I'll put the link to the recording on the module portal on Tulip. I hope that you've both been able to get on to Tulip and see everything on there. I'm just going to unmute you a minute, Bonnie, so that you can respond. So, Bonnie, have you been able to get onto Tulip?
I can still hear you, yeah,
Yeah.
I can still hear you. I'm not on Tulip yet now.
Okay, right. Well, let me know if you have any problems getting on there, because we need to get you on there. I know that Rachel's on, so I'm going to carry on now. I'm muting you again because you're quite noisy.
Okay.
So but oh, hang on, I'm just going to unmute. I'm just unmuting you again, Bonnie. Have you tried Bonnie? Have you tried getting onto this? Opening up another chat room.
I think I'm in a chat room. I'm talking to somebody called Rachel. Which
Oh yeah, that's it. Great. Let me have a look. Let me have a look. I'm going to close that down. Yep, that's it. You're there. Great, brilliant. Okay, so you're both, and that's just, it's only the three of us today, Rachel, Bonnie, and myself. So why don't we just have a go at using the chat room for a minute in the way that you might want to use it. And you can use this chat room is there permanently. You can open this up at any time. So, for example, if you wanted to have a chat with Rachel about something on the course, discuss something, you could say, why don't we go into the chat room? You could both open up the chat room. You've got no visual of what I'm doing. You can hear me though, can you, Bonnie? Are you not seeing the chat room? Are you not seeing what actually those words? Yeah. Okay. So what you're seeing is my version of the chat room. So I see. Yeah. When you've got, it's because you've got two windows on your computer. So when you go into the chat room, the visual from the webinar goes behind your window. So if you minimize that window, for example, you should then find the GoToWebinar window behind it. Oh, you've lost all visuals. Okay, right. Okay, I'll carry on if you can still hear me there. I'm going to close a few of my own windows down here a bit. Give it a bit more space. One of the things that you would find with any computer is that if you've got a lot of windows open, email, lots of other things happening, you'll find that it slows the computer down and you don't get as much response. So I'm actually closing some of my own stuff down here. I've got a million windows open up behind. So you should be seeing, at the moment you should be seeing my screen, which is currently just a blue thing with my talking head appearing in the middle of it. And now I'm going to put the chat room back up again to see if you're seeing that. Yeah. Yeah. Okay. Well, so the reason when you're looking at the chat room, this bit here, this is the chat room. When you're looking at this, it covers up the webinar, so so you'll still hear me, but you won't be seeing my screen because it'll be covered by the chat room. The webinar screen, GoToWebinar, will be covered by the chat room. So you'll have to sort of listen to me to say, okay, come back into the webinar to see what we're doing. So let's hopefully see if you can do that now. So if you minimize the chat room or change your, for example, I'm showing, if you can see it now, I'm showing you what I'm seeing on my screen. So you should be able to see the chat room as it appears on my screen. And now going back into the webinar. So I'm now going to go back to the PowerPoint, and hopefully you're now looking at the PowerPoint, and I'm going to sort of carry on for a bit. So it's now 4:15, so I think I need to try and move on a little bit. I'm going to miss that one and go from there, just to sort of try and remind you of what we're trying to do here. So once you get in, I know that Rachel's been on the portal, and Bonnie, once you get there, you'll find there's a number of attachments already there in the shared area, giving you sort of the learning objectives of the different blocks within the whole module. So within my part of it, so if you think of the module as having like the 6 parts for the 6 people, so myself, Heather, Ruth, Bridie, Janet, Catherine, each of us have got like a little part of the course, and we've got each got our own little bit of learning objectives within the overall whole. The overall whole is to sort of think about those issues which will affect health and social care services in the future. So within my bit, I'm thinking about that. You should be able to see this on your screen now. The 7 trends in information technologies that are changing health and social care. Only very briefly, we were a bit short of time yesterday, did we sort of discuss the ideas of equity and digital and other technology divides. You may remember I showed like a graph showing the idea of digital divisions from those people up one end that will be sort of quite advanced in using technologies, down to those who aren't on the internet at all. And I gave some examples yesterday of research looking at that type of illustrate the trends in technologies, but also addressing technological equity. Today I'm going to briefly talk about decision support and expert systems, social media and online therapies, and then in the next webinar we'll be looking at patient access to records, eHealth readiness and health promotion, and then the final day-to-day face-to-face in March will be like a recap in a way of what we did yesterday. So just to remind you of what I think of the 7 trends in information technologies at the moment, we've got electronic records decision support, mobile, patient-led and social media, sensors, telehealth, telecare, wearable technology, big data and robots. I wonder if there's if you understand those words okay, or if there's anything that you want to ask about those particular words. So I'm going to stop just there for a minute and go back into the chat room to see if you have any questions or comments about either about what was presented yesterday, about what we're doing just now, or about those words. So I'm going to give you a chance to tell me how you're getting on. Okay. Okay, so you're both happy with yesterday. So Bonnie, you're still not getting a visual. That's because you're looking at the chat room, I think. If you were to go up to in your chat room, if you go up to the to the top right hand corner and minimize your chat room, I think you should, you can't, without losing me. You're because you should have 2 windows open. You see, you should have one window which is my webinars, and you should have one window which is the chat room, and you should be able to even close the chat room down altogether and carry on seeing and hearing me. Do you want to have another go? Do you want to just try it, Bonnie? Have a go. So what I'm going to do is to put you onto audio. Just bear with us, Rachel. Just try and get everybody working here. Where are we? Attendees. So, okay, you're unmuted, Bonnie. Are you still there? I can hear you.
I can hear you still, Ray, and I'm talking to Rachel by chat, but I cannot get your visual up. So just carry on, and I'll have to access it another time.
Okay, right. Okay, I'll just carry on then, and I'll try and explain everything that's on the screen so that you don't miss too much. Right. So you're basically all happy with these 7 trends of information technologies. So I'm going to carry on from that point. The next thing I wanted to talk about was under electronic records and decision support, and talk about computer patient interviews, decision support, and expert systems. So let's just think. You're in A&E and in midwifery, so I'm pretty sure that there have been computer patient interviews in those areas. I know that that the computer patient interview has been used in various emergency departments in the States, and probably in midwifery as well. The idea of computer patient interviewing started in 1960s, so quite a long time ago, with a paper by somebody called Warner Slack in USA, and it's been going on for a long time. It's been going on for that's now 50 years. Incredible. 50 years we've been doing computer patient interviewing, but it's still not quite as widespread as you might expect it to be. But there's plenty of scope for it. So there's been various things. I came from Glasgow, and a colleague of mine there called Robin Neil-Jones had developed a computer patient interview for dyspepsia. It was called GLADYS, the Glasgow Dyspepsia System, GLADYS, Glasgow Dyspepsia, and that took signs and symptoms of people who had the possible symptoms of dyspepsia, so abdominal pain and so on, and it used it to make a prediction or make a suggestion as to whether this was possibly just dyspepsia or whether it might possibly be something more serious. So it would be a series of questions. Do you have bloating? Do you pass wind? Are your stools funny colour? Things like that. And it would, depending on your answer, yes or no, the interview would branch off to other questions. And this idea of a branching questionnaire online, where you can have thousands and thousands of questions, but of course you only go down one particular path, is become quite mainstream in the USA. And if you once you get onto the portal, you'll find, I haven't put it up there yet, but I'm going to put up a series of links, other things that you can look at and read. There's a link to one of the previous webinars that we've done that a man called Alan Wenner. In fact, if you search after this, you could search for Alan Wenner, A-L-L-E-N Wenner, and Plymouth webinar computer taken patient histories. You'll probably find it anyway. It's on the University of Plymouth website, and he explains how this system called instant medical history is now being used quite widely within general practice in the States. Currently ourselves, we've got a proposal to develop an allergy interview, which comes a lot further developed something that we did in developing allergy pathway. So we've developed an allergy pathway which is now a map of medicine, but we're developing that further, so more detailed, so it becomes a patient tool, and patients can answer the questions, and that will help people in the triage of people with suspected allergy as to whether they need a referral onto the allergy clinic at Derriford. So this is work with, I don't know if you know the allergy clinic at Derriford, Bonnie. It was Ed Kaminsky. He's just retired now, but we're still working with Ed. So this was a system which was supported Map of Medicine. I don't know if you're both familiar with Map of Medicine. Map of Medicine is something that particularly GPs use quite a lot, where it gives them it gives them pathways for different patient groups and helps supports their decision making. So it's this idea of decision support. If either of you want to look, we've got actually a website called the Peninsula Allergy Service website, which has got where some of the Map of Medicine pathways are available for GPs, and there's also a website for discussion forums for patients and professionals. So if you can see this, Rachel, and Bonnie, you'll get it in the recording afterwards if you can't find it now. It just shows you the sort of flow chart that you might have. So you have a question, Does the patient only present with an itchy mouth or throat after eating food? Yes, you go down the path on the left-hand side. No, you go down the path on the right-hand side. So no. Does the patient present predominantly with gastrointestinal systems? And then yes and no, and so on. I'm sure you get the idea. That sort of decision support can be done for a variety of areas, and I know that's been done in emergency departments as well as, I'm pretty sure, in midwifery. So patients with suspected allergy were going to be asked by their GPs to answer the online interview at home. The computer will then summarize those presenting symptoms and give a provisional view on whether a referral is needed, because at the moment these referral letters are going to tracks for Derriford and darts for Devon and so on, these referral centres, and if someone's actually scanning them themselves, but we can get a computer to do some of that for them. And then details can be printed with educational information for the patient, and also emailed back to the GP. So that's one of the things that we're trying to do. So in the chat room, let's talk about this now. I don't know if you can see this, Rachel, and I'll read it to you, Bonnie. What do you see as the main barriers to implementing this type of decision support in your area? If you were to do some sort of patient history taking in midwifery or patient history taking by computer in accident emergency, what do you think would be the main barriers, and are there any pathways that you can think of that might be usefully developed into a computer interview? So I'm going to stop talking a minute and I'm going to go back into the chat room to see what you're saying. So the question is, do you see possible use of computer taken histories in your clinical area? Yeah. Okay, Bonnie. So that would you mean in general practice? All right. So Rachel, do you think that they would be more or less honest with a computer? Certainly, the people in the past have found that with, say, for example, alcohol histories, people actually are more willing to disclose things to a computer than maybe to their GP. When you, Bonnie, when you say remote areas will struggle, is that remote areas will struggle for internet access, you mean, or because I mean what we're hoping here is that people might be able to answer computer history taking at home and then get a more directed and better referral where the referral summarizes their clinical history to date. Okay. I'll see if I can after we finish. I'll see if I can find the particular papers that may relate to computer patient history taking in your areas. In fact, at A&E, I did think that this would be quite a good project to try in A&E. I came and talked to Jason Smith, is it? I can't remember, one of your consultants there, about the possibility, and it'd be quite a project that I'd quite like to do, really. Jason Smith, yeah. Okay, I'll carry on back to my PowerPoint now. So we wonder if either of you have heard of this thing called IBM's Watson. I mean, when you think about most contacts with clinicians, they are or many contacts with clinicians are, one of the fundamental parts of it is a history taking and diagnosis. I mean, obviously, perhaps it varies from the place and the type of contact. In A&E, you've probably got much more practical work to do in terms of X-rays and mending broken bones and dealing with wounds and so on. In midwifery, of course, you've got the practical side of the getting up to delivery, but there is quite a lot of what you do will be history taking, and in some things more like mental health, for example. Clearly, history taking can be quite a major part of it. Things like allergy, actually, it's quite a good, because taking a good history is really crucial to getting the good diagnosis. So what we've been talking about so far is that structured idea of taking like a sort of yes, no, have you got this, and then it determines what the next question is. What, of course, human beings do as opposed to computers is they tend to sort of jump stages, and you jump further on because you can guess really what some of the answers might be, and if not, you can always come back. So you do it in a more, not necessarily such an automated sort of robot-like way of doing things. And one of the things that people are trying to get computers to do is to be much smarter and to do things using what's called artificial intelligence, that sort of fuzzy logic. I don't know if any of you have heard about IBM's Watson. I'm going to, you may not have seen it yet, but you can always Google IBM Watson after this and have a read of some of the things to do with IBM Watson. This is a computer that they've got it playing chess, and they've got it starting to do diagnosis. So we're getting really large computing power, able to start doing sort of really quite difficult, what you might think of as being human intelligence type of tasks. But it becomes much more flexible. And I think one of the things we will see over the next 10 years is an increasing use of this sort of expert system approach. Expert systems have been coming around for quite a while. They haven't really taken off, but I think computing has now got to the stage. I mean, Watson has beaten people at chess. Some of the grandmasters have beaten them at chess, and it's doing some aspects of medical diagnosis as well. I'm now showing, so Rachel will be seeing this, but I'm now just showing one of the screens from Watson, but you can Google this afterwards and follow it up. So moving on to another one of the 7 trends in information technology, I'm going to talk briefly now about patient-led innovations and the use of social media. And I just put this up a bit yesterday, so where I talked about a website called Patients Like Me, and if you haven't looked at it, you might follow this up by having a look at Patients Like Me, and also maybe if you're not on the Twitter yet, it might be good if you could get onto Twitter, and then you could have a look to see the sorts of things that people on Twitter do. Ninja Betic, certainly, she's got loads of followers, and she's just a typical young person with diabetes and they're discussing their diabetes. So she's got sort of 2,500 followers when I grabbed that screen. So here's a conversation between Ninja Betic and some of the others. Or, hey ninjas, Hayley has a question about her pump. Can anyone help her with some advice? Thanks. And then presumably a bit later on, somebody comes back with some information about pumps, and somebody else, and they sort of just chat generally, putting in stuff about their own lives, but also things about their diabetes. So one of the things that we did with Ninja Betic was we got her to ask some of her followers about which apps and which sites they used in relation to their diabetes, what they liked about those apps and sites and what they didn't like, and we asked in particular if they, as young people with diabetes, were to tell their diabetic specialist nurse one thing about diabetes app sites, what was it? And so we used that, and within sort of 2 or 3 weeks, we were able to do a survey of young people with diabetes and find out what they were doing, what they were using. So again, Bonnie's not seeing this, Rachel is hopefully. Some of the sites they were using sites for blood glucose recording, sites for nutrition, for peer communication and support, sport and exercise, general information. And then actually there were some sites they weren't really using, but we added them on as other things they could be using. They could be using their GP websites. So some GPs do offer access to your own records. They offer repeat prescriptions. There are sites with psychological support, and the actual competition that we ran was preparation for the consultation. So I'm now showing a screen called My Diabetes My Way. This is a screen from Scotland, where all people in Scotland have now got access to their own medical record. All people in Scotland with diabetes have got access to their own medical record via this website, and it integrates information both from the hospital and from general practice. Shame it's not got taken off yet in England. Moving on to one of the other things that patients have got, psychological support. There's various sites around, such as Living Life to the Full, Mood Gym. These are both sites for people with depression. And in this competition that we ran, these teams developed various apps for mobiles or websites. And I'm showing them on the screen now: Diabetes Logger, Insulin Calc, Diabetes Health Tracker, CP Slider, those are for calculating insulin doses, You and Your Diabetes, and Tinder, which were things to develop a list, an agenda for taking into the consultation. So that's the sort of thing that they developed. I'm just going to go back into the chat room, just check that you're both okay. So yeah, great. So okay, so I'm now looking to see what you're putting in the chat room, and Rachel's talking about the booking history. Bonnie's replying. Okay, so hopefully you're both okay and you're still both with me. Do you want to just say type something in the chat room just to sort of, do I carry on? Everything all right so far? Right, okay, good. So I'm back onto my slides again. And another project that I very briefly mentioned yesterday was one called Sharp Talk. This was a project for young people who self-harm, and our aim was to get young people who self-harm and mental health professionals together online to see how well they could communicate with each other about self-harm and its management. We recruited 77 young people, aged 16 to 25, and 18 recently qualified health professionals, and we allocated them to 3 discussion forums. I don't know if either of you take part in discussion forums, but there are thousands, maybe even tens of thousands of discussion forums out there on different topics, many of which are in health. We ran 3 closed forums for the people in this particular project. And the young people who took part liked the small and supportive community that was there, and they chatted, they played games online, but they also supported each other, as well as discussing the sort of more formal issues that we introduced every now and then to debate, to get their views about how services should be delivered. But they used it extensively to support each other and interacted with the research team. One of the crucial issues for these young people who self-harm was that they were anonymous in this in these discussion forums. They were anonymous to each other. The only contact we had with them was through an email address, most of which were generally fairly anonymous email addresses on Hotmail or Gmail. It wasn't really .jones@plymouth.ac.uk. So, but Firenze at Gmail. So we don't know who they were. But we built up a picture of who they were by their discussion, but we didn't know who they were in real life. The health professionals in this project, despite registering, didn't really take part actively, and they reported barriers such as lack of confidence and concerns in using this sort of format of talking with these clients, these service users, but also perhaps there was a lack of clarity as to what their role was in the project. We we concluded that although this anonymous online environment was used greatly by the young people, it was too unstructured for health professionals. So as a result of that, we carried on to another project called Stakeholders Online, where we ran 1-week courses in which mental health professionals and service users over a sort of slightly more structured period of 1 week, with a beginning webinar, discussion forum and an end webinar, were participating online together. Again, they were all anonymous. So, and this was very important for because professionals were able to as well admit that they didn't know about things online, as well as the service users being able to say things which they might feel critical about the service, perhaps which they might not like to say face-to-face with professionals. So in this sort of circumstance, the anonymity was very useful. I don't know if you've been watching on the news this stuff about, I can't remember her name, the woman who was promoting the Jane Austen for the banknote, and the terrible anonymous trolling that went on Twitter. So the anonymity online clearly has a downside, but it does have a positive side as well if you got it in a controlled environment, such as on a project like this. So anonymity can be a good thing as well as being a cover for trolls, and it's one of the things that we have to put up with really on the internet. I'm going to type this into the chat room as well in a minute. Let me copy it and put it into the chat room, which is, I'm asking for a question. What do you think is a way forward for using social media in health services, taking into account the findings about anonymity in Sharp Talk and stakeholders online, but also the use of patients like me and Twitter? I'll copy that and put it into the chat room. There we are. So we're into the chat room now. What do you think? Are either of you social media users? Do you use social media at all? Yes, I think that's important, Rachel. I mean, that these sites that we had with the Sharp Talk project, where they were closed sites, so people had to sort of register to go in and use them. I mean, what we see with Twitter is that anybody can open as many accounts as you like. I mean, I've got about 5 Twitter accounts, some for different projects, one for work, and my main general one for work, and I have one for my home tweeting. All my accounts, all my Twitter accounts are clear who is the owner. Even my home one, I have a different name, but I say that it's me underneath. Yeah, I think if you haven't got onto Twitter, either of you, it'd be worth a while look at it. Twitter's very easy to use, and although it's got its dark side, it is quite useful for there's a thing called We Nurses, for example. I don't know, you might be interested in, where nurses, they get together, they have a Twitter sort of evening where they all chat together about a particular issue, and they find it really quite supportive. You can use these things really as much or as little as you like. I mean, what's I think interesting is whether or not the question of anonymity. I mean, I'm not sure how you'd feel about. Personally, I wouldn't like to disclose my whole patient medical history on patients like me, but there are thousands of people on there who've done that. I don't know if you've ever had a look. See, I think one of the things that professionals can do is that they could, I mean, for example, particularly with the follow-up of people with long-term conditions, I mean, you could imagine that Paddy English, I don't know if he does this yet, who's diabetes clinic at Derriford, could set up a closed forum for his own patients. Maybe, maybe he might say set up a group of 20 or 30 young people with diabetes and get them to discuss their own issues, and he might drop into the chat room every now and then to see what people are saying and to offer some sort of professional advice to them. So I mean, I think there are possibilities here. It's just a question of working out how best to use it. Okay, I'm going to carry on with the with my PowerPoint. One of the other things that you can find online is, I haven't actually listed it as one of the 7 trends because it's not especially new, but we do see things like CCBT, computerized cognitive behavioral therapy, for depression in these sites such as Mood Gym and Living Life to the Full. That type of psychological therapy is really quite well suited to the computer approach because it involves trying to teach people really how to control their thoughts better. So that type of online therapy works well. There's been other online therapies for trying to reduce people's drinking and health promotion, and we'll come back to that a bit in the second webinar. So I've done some work with Living Life to the Full, looking at how well it's used across the country. So if Rachel, you can see this now, you'll see there's a map there, and with varying degrees of the use of this particular online package. Now this is an online package which is available to the world, so you think, well, there shouldn't actually be differences across the country because there's no major difference in the rate of depression across the country, so why is there a difference in the rate of the use of an online therapy? And one of the advantages of online therapies, of course, is that they should be available across the country to those who've got the internet, of course, but there's not any regional variations really in the use of the internet. So when you see a regional variation like that map there, it's because simply there's a lack of awareness in certain regions, or professionals aren't recommending it. So one of the things that I think we should see more of in the next few years is professionals recommending to go away and use this site, or go away and look at that site, particularly helping patients find good sites. And we did a study looking at the use of Google Ads to raise awareness, and found that it was actually quite useful. I'm going to skip that actually because time's pressing on. I'm skipping this current slide, and oh no, that's the last one. I won't skip it then. I'll go back to it. What I was going to suggest that you might do over using the chat room, and what I'll do is I'll put each of these questions up one by one in the chat room so that you can pick them up there, even though you can't see my screen, Bonnie, in a second. So put the first one in. That's strange. Why is it saying that? I don't know why it's the chat room's giving me strange things at the moment, doing strange things for me. That's better. Let's do it again. Anyway, well, I'll talk you through it, and I'll just type it out by hand. I'm not sure why it's doing that. I was wondering, really, if you could think about over the next few days using Google or NICE or others to find out what online therapies or patient education is being used, and anything else you could find. And this is really the end. This is what you would be doing for the rest of my bit of my module. Let me just try this again. See if I'm going to try it one more time. That's better. Right. So you might this is like your homework, if you like, and we're hoping that Zoe and the other person, Josephine, I think, will join you. So there's 4 of you in the module. You can either come into this chat room to discuss it, or what I'll do is I will email the 4 people with the email addresses that you find. Sorry, I'm burbling. Bonnie, I know that you use your NHS email most. Rachel, you're fine with the Plymouth AC UK, I guess. Shall I send you both an email so that you know each other's emails? Because you might want to just discuss this briefly either by email, or you could use this chat room to carry on discussing stuff. Okay, so I mean, I'll just do that as an email now. Actually, just hang on a second. No, I'll do it afterwards. But what I'm wanting you to do is to think about some of these issues, and this is like your sort of homework for the rest of my little block, and then you've got your next webinar with Catherine coming up in about maybe next week sometime. Let me just put this in here a minute. And what I was hoping that you might do was between you produce a short summary, and let me see if I can do this. I might modify this a minute to be more suitable, being there's only so agree amongst yourselves. That's what I was intending to do. There's only 2 of you. We'll need to see if we can get Zoe and the other person in to this discussion as well, and then you can either meet online using this chat room. It's up to the 2 of you really, or you can just do it by email, where you go away, look at the use of Google to think about online therapies, and just produce a little summary of what you found. Email is easier for you. Okay, is that okay with you, Rachel? You want to use email? Didn't actually say put that up. Yeah. Okay. I'll just leave it up to the 2 of you, and what I'll do is I'll email Zoe and the other person whose name I've forgotten, and what I'm asking you to do is between the 4 of you, or it may be between the 2 of you if the other 2 don't sort of log into this, but at least between the 2 of you, have a quick look and produce at most 1 page, half a page would do, just the things that you find to do with online therapies, and what you think their use might be in particular areas, if you find them to be useful. So have a quick look through Google, maybe look on NICE or some other databases, spend some time on this, just finding out what online therapies or patient education seems to be in use at the moment, and produce sort of a short sort of statement, if you like, between the 2 of you as to what use you think this will be over the next few years, and then one of you can email it to me by Tuesday midday, and then I'll sort of respond, and then that will be the end of this little block, and that's it really. So it's 5 to 5 already. I'm going to sign off from here, so goodbye, and what I'll do is now I will email you both, and email the other 2 as well, and with what your sort of homework, if you like, is for the rest of these next few days. So thanks a lot, and goodbye. Bye. Oh, Rachel was just picking up Rachel's maybe sort of just a bit of both, and I think you're right to pick out the difference between patient education and therapy. So maybe, I mean, what you might do is one of you might choose to do patient education and one might look at therapies, and then just a few notes on it. I'm not looking for a massive thesis or anything on this, just sort of a look at this and a think about it for over the next few days. Okay, I'll email you just now. Thanks then, bye. Bonnie, we're waiting for you. To see if you can get into that. So if you can't get into it, just you could email. I'm just looking at, as I say, what you're seeing is everything that I see on my desktop. So when I have a quick look at my email just to see if someone's there sending me an email, if necessary, you can mobile phone me if you're having any problems. But I think I will sort of carry on with the rest of this this content. So what you've got on your right hand side is you've got well, first of all, I'm hoping that you get in that chat room. Rachel's there, but and you should get this chat room so that you see a list of names on the right hand side, and you should be able to type in your comments at the bottom. Maybe you can have a go at this after the web chat, after the webinar, Bonnie, if you're not able to get there at the moment. There is a question and answer thing on the GoToWebinar screen, but I prefer not to use that because I prefer to keep everything into the chat room, because that's where we'll get the recording. So welcome to the first webinar in this module. I hope you enjoyed yesterday. I found it useful. It's going to be a very sort of small group of you. At most it's going to be 4, I think. So there's yourself, Bonnie Tromans from Derriford, Rachel Stania, who's a member of staff. I forget which school you're in, Rachel. Are you in health professions? Zoe, what's her name? Zoe, I forget. I'm just going to go back to the chat room. Zoe, I can't remember where Zoe's from. And then there's probably Josephine, who would be the 4th member of the module. There may be some other people. Rachel, you're logged into the chat room, I see. Great. Bonnie, I don't know if you want to see and get into that. Bonnie, you have to open up another web browser. So onto your Internet Explorer or Chrome, whatever, open up another window, and in that window type this address there, http://hes.plymouth.ac.uk/chat/, and that will take you to something that looks like this, and you'll see there that Rachel and I are both in there. You're in midwifery. Yeah, sorry about that, Rachel. I couldn't remember where you were. Others are paying more attention, so you can talk to each other even if you're not listening to me. So I'm going to just go into that chat room again, just one last look at it, and okay, Rachel, you want to try your microphones? I'm going to give you one more chance, Rachel. Okay, so you're unmuted. You want to try talking? No, I'm not hearing anything, so it doesn't look like your microphone's working. So we'll stick with the typed chat. Bonnie's microphone works okay, but she's got a very noisy background. She's in the middle of the A&E department by the sounds of it. So we'll just carry on using typed chat, using that webinar. Okay, that's Rachel. But just one more look to see if Bonnie's there. No, never mind. I'll carry on talking and just go through some of the content, and we'll see how we get on with the with communicating with the two of you. So I was going to stop at this point and get you to talk to each other in the chat room, but as there's only Rachel in there, it's a bit difficult. I am recording this already, and I'll put the link to the recording on the module portal on Tulip. I hope that you've both been able to get on to Tulip and see everything on there. I'm just going to what actually those words. Yeah. Okay. So what you're seeing is my version of the chat room. So I see. Yeah. When you've got, it's because you've got two windows on your computer. So when you go into the chat room, the visual from the webinar goes behind your window. So if you minimize that window, for example, you should then find the GoToWebinar window behind it. Oh, you've lost all visuals. Okay, right. Okay, I'll carry on if you can still hear me there. I'm going to close a few of my own windows down here a bit. Give it a bit more space. One of the things that you would find with any computer is that if you've got a lot of windows open, email, lots of other things happening, you'll find that it slows the computer down and you don't get as much response. So I'm actually closing some of my own stuff down here. I've got a million windows opened up behind. So you should be seeing, at the moment you should be seeing my screen, which is currently just a blue thing with my talking head appearing in the middle of it. I'll mute you a minute, Bonnie, so that you can respond. So, Bonnie, have you been able to get onto Tulip?
I can still hear you, yeah, I can still hear you. I'm not on Tulip yet now.
Okay, right. Well, let me know if you have any problems getting on there, because we need to get you on there. I know that Rachel's on, so I'm going to carry on now. I'm muting you again because you're quite noisy.
Okay.
So. But hang on, I'm just going to unmuting you again, Bonnie. Have you tried getting onto this, opening up another chat room?
I think I'm in a chat room. I'm talking to somebody called Rachel. Which
Oh yeah, that's it. Great. Let me have a look. Going to close that down. Yep, that's it. You're there. Great, brilliant. Okay, so you're both, and that's just, it's only the three of us today, Rachel, Bonnie, and myself. So why don't we just have a go at using the chat room for a minute in the way that you might want to use it. And you can use this chat room is there permanently. You can open this up at any time. So, for example, if you wanted to have a chat with Rachel about something on the course, discuss something, you could say, why don't we go into the chat room? You could both open up the chat room. You've got no visual of what I'm doing. You can hear me though, can you, Bonnie? Are you not seeing the chat room? Are you not seeing